My name is John Brody, and I was a patient at Chippenham Hospital from June the 3rd till June the 20th.
Mr. Brody is a very active, physically fit, middle-aged male who was riding his mountain bike. And he had an accident in one of the trails at Pocahontas State Park. And in fact, he was laying in the woods, quadriplegic, meaning he couldn't move his arms or his legs, until someone passed by and saw him.
I don't remember hitting the ground, but I do remember going over the handlebars. I was on my right shoulder. That's how I ended up at the end of the fall. I felt a great deal of pain in that shoulder, even though I couldn't move anything. There was a lot going through my mind on the ground because I had about a half an hour before Stuart found me. From there, ambulance came to the park, and a lot of people had to be involved because I was miles in on the trails. They were able to get an ATV within a mile of me, and then they carried me a mile to the ATV, and then from the ATV to the ambulance, and then drove me to the emergency room at Chippenham Hospital.
From a spine standpoint, we would want to take him to the operating room as soon as possible. He had a severe spinal cord injury in his neck, his cervical spine, but he also had a little hematoma in his brain. So we were delayed a day or two because of the bleed in his brain. Once that was considered to be stable, we went to the operating room for surgery. As most people know, there's nothing we do now that repairs the spinal cord, but we can certainly take the pressure off the spinal cord where it's compressed, and we can stabilize the spine where it's unstable. We went through the front of his neck to get to the spine to get the pressure off the spinal cord and stabilize it, and then had him go face down and did the same thing from the back. So very aggressive, decompressing the spinal cord from the front and the back of the spine, as well as stabilizing it so he could get up and start moving as quickly as possible.
I woke up in ICU. From that point on, it was just superb. The attention to me, especially given that I can't move and I can't talk. So all I am is a blinking head. I can't even move my fingers. So everything has to be done for me. You start to realize that it takes special people to be in these jobs. Not anybody can do this. The nurses aides, the doctors, everybody was superb.
At Chippenham Medical Center, one of the things I hear from patients a lot is how, in general, they're very happy with the services they get, meaning how they're treated from the nursing staff, the therapy staff, the anesthesia staff for surgery. So I think in general, there's just a well-rounded team. Some of these surgeries are fairly complicated, and you can't do them at every hospital.
I can tell you, I wouldn't want to go anywhere else. It was something, and that's if anybody ever asked me, there would be no question in my mind where to go. You get your butt to Chippenham Hospital if you want a high level of care.